San Benito is a township located on the northern side of Lima, in the district of Caraballo, 34 kilometers from downtown Lima. San Benito is one of the many poor townships around Lima. The effort to develop and grow in San Benito is delayed by its isolation from local municipal and government agencies by a river, which makes it difficult for the population to access state services. 2,400 families live in San Benito, a population of 12,000. They live in extreme poverty. This is made worse by the economic growth of Peru, which leaves a big gap between the haves and the have-nots. There for all to see. It is here in San Benito where the NGO Warmiwasi, which means Women's House, and promoted by the Columban Fathers, has begun to respond to the urgent needs of the population, looking for solutions alongside and with the people.
The Columbans, since we've arrived in Peru, have always worked closely with the pastoral indications from the Church of Latin America in their conferences in Medellin, Puebla, and recently in Aparecida. And the strong pastoral implication of the option for the poor, along with the option for youth and the situation of women, especially doubly exploited from the economic situation of poverty and machismo, is what led me always in my pastoral work with the Columbans to have an area of work with women and family.
The population of San Benito began arriving in 1992 and is now divided into 8 zones. Water still comes in trucks and is kept in cylinders. The streets are full of dust and the rain makes everything damp, which make living conditions very hard for the people. Each morning, the people leave very early to go to work and come home late in the evening. The families have very little time to spend together. It is common to see women in the streets of the township carrying their children on their backs. The women feel they must remain at home and administer well the little money their men bring them. As mothers, they feel obliged to take care of their children, and so postpone or sacrifice their own aspirations and dreams.
Bueno, mi nombre es Isabel Morales y yo tengo 4 niños. Tengo 2 niños en la tarde y ahorita lo dejé a mi hijo que tiene 7 años con mi bebé que está durmiendo. Y yo prefiero no dejarlo a nadie, yo prefiero dejarlo a mi hijito y hasta que duerma nomás algo también, ¿no? Y yo sé que a qué hora se despierta y tengo que regresar rápido. Y otras personas no tengo confianza ni en los guaguaguases, nada por el estilo.
Whatever happens at home, the mother has to take the blame, and against her the accusing eyes look for her to give explications. The violence against women and the infant malnutrition are 2 of the many faces of urban poverty, which the NGO Warmiwasi has been working at, not just with the women, but with all the population. Family violence, sexual abuse, and desertion inhabit the humble walls of the houses in San Benito. To attend the cases of family violence, we do so in 3 main ways. First, by involving the participation of the community in the attention of cases. The fruit of these years has been the ability to gather and gain the participation of the social organizations of the township, such as the committees of the Glass of Milk program, the lunch programs, the parents from the schools, and the participation of the local chapel and teachers, all of whom are aware and up to date with the project. The promoters are key people in the community who have been trained in detention, legal advice, emotional support, and how to accompany cases of family violence. When they know of or feel there is a case, they go immediately into action following the procedure set out. In an agreement with the local municipality of Caraballo, they have recognized the individuals and groups as promoters.
Warmiwasi hemos trabajado, bueno, yo vengo trabajando yo año y medio aproximadamente aquí en San Benito. Del inicio, gracias a Dios, hemos trabajado con Warmiwasi, ¿no? De la mano, porque por ejemplo lo que son terapias de familia, ayuda psicológica a los niños, a las madres, a la familia en general, me ayuda bastante, porque tengo a dónde derivar, a dónde pedir ayuda. ¿no? Entonces trabajar en conjunto con ellos ha sido pues algo muy gratificante para mí.
Work has been done with teachers from 4 schools in the area to be aware of the signs of violence in children. The teachers are like a team on the lookout and alert the respective institutions when they discover children have been mistreated. Second of the ways in the project is the special treatment offered to cases when they are referred to Warmiwasi by the DEMUNA, Municipal Defense of Children and Youth, and other institutions. We have attended 70 cases a year for the past 3 years. 70% of them are family violence, of which the majority are women. The third main way consists in making other institutions be aware of these services. We have created a system of integrated attention with the state institutions such as the DEMUNA, schools, medical center, Center of Emergency Service for Women, and local prosecution service.
El compromiso está de continuar coordinando para todas estas acciones, no solamente para las acciones preventivas, sino también para la atención, ¿no?, de las víctimas, que ustedes hacen una parte, nosotros hacemos la otra parte, que de repente brindar la asesoría legal, ¿no?, a los casos que se presentan.
San Benito y Juan Pablo, la jurisdicción se está haciendo la evaluación dentro de los niños, dentro de los que acuden a mi consultorio, más o menos la desnutrición está en un porcentaje del 15 a 20%, varía. Y entre lo que es riesgo de desnutrición, más o menos está en un 35%, que es bastante alto. Se tiene la idea básicamente que porque la familia es pobre, el niño tiene que estar mal alimentado.
This is something that the Warmiwasi team has also discovered when they talk with the mothers about infant nutrition. They realized that of all the people, the most at risk were the youngest children. As an answer to this, the team proposed 3 ways. The first is direct intervention. The people in San Benito do not see malnutrition as something that requires immediate attention. It is not easy to overcome this attitude. It is necessary to work on strategies to help families be more aware of the need to pay attention to the health of their children.
Debe ser el hecho de que también nos identifican, no sé si por ser Warmiwasi o por ser alguien que va a su casa y le pregunta algo que no es lo usual acá, porque desplazarse por aquí es como difícil, pero debe ser ese hecho el que hace que la señora misma te empieza a contar. Yo veo muchas mujeres aisladas, a diferencia en otros lugares, las señoras siempre paran en su casa, solas, es difícil que tengan, digamos, que se hagan muy amigas, entonces cuando uno va a visitarlas, a veces de una cosa tan inusual, conversar sobre, no sé, sobre el clima, sobre qué ha cocinado hoy día, señora, qué ha hecho de almuerzo, abre la posibilidad de que empiecen a salir también otros problemas.
The home visit allows us to gain the confidence of the mothers and see the way they prepare their food and what hygiene care they take. Then, we can propose and suggest changes that will help the health of their children. Health campaigns against anemia and parasites are conducted. Nutrition advice is given. Workshops are run for breastfeeding mothers, and campaigns of weighing and measuring children in the schools are some of the many activities the project undertakes. The most important thing is that all these activities, which we began by doing ourselves, are now being run by the state in the form of the staff of the medical post and the schools. It is not an easy work, as those in government have often developed programs that just fill the gap without solving the problem of malnutrition, such as food hands out, which is not sustainable and only create dependence on the state. To break with that way of doing things is not easy. Bad habits are not easy to change. For that reason, and for the ongoing nature of the project, it has been essential to obtain the participation of the women of the community to assume the work of the project. We have run a training course for the women leaders to be community accompaniers, for them to continue the work developed in the project. The training continues in a practical way, in carrying out their tasks and then evaluating them. Teachers from the different schools have also been trained to reinforce the changing habits of the lunch boxes prepared by the mothers. 9 teachers are involved, and they keep an eye on some 180 children in their schools.
Bueno, al comienzo, ¿no? Siempre las golosinas, ¿no? Las mamás corrían a la tienda a última hora, compraban su galleta, su gaseosa a veces, su cifrú, su pulpín, ¿no? Y su yogur, ¿no? Y todo esto casi se repetía. Entonces con las mamis se tuvo que hablar, ¿no? Con ellas para hacerles ver que esto no era alimenticio, ¿no? Para los niños, ¿no? Y también cuando ustedes ingresaron a las reuniones, a explicarles, ¿no? Sobre una alimentación balanceada a los chicos. Entonces las mamás fueron cambiando, pero de verdad que con bastante esfuerzo había que estarles siempre diciendo las cosas, mandándoles el cuaderno de control y a veces hasta con el acuerdo, ¿no? De los padres de familia decomisando las golosinas, ¿no? Porque a veces algunas no entendían. Y ahora pues ya traen su papita sacochada, su huevo, su choclo, su cancha, traen sus panes, sus refrescos también se les explicó, ¿no? Ahora traen sus agüitas de tiempo, sus chicha morada, ¿no? Todo eso ha cambiado bastante.
Nearly all the activities have been achieved thanks to the participation of the community organizations. The Ministry of Health has now assigned a nutritionist to work in the medical post for 3 days a week, thanks to the pressure of the people. Before, it was twice a month. The schools in the area are part of the project. 3 of them with 12 teachers are very much involved, especially the infant ones.
A veces la desnutrición infantil está pasando a ser parte del paisaje y por eso no se interviene, o a veces se tira la toalla porque es un tema difícil, pero nosotros estamos 3 años aquí y hemos visto niños de 3 años y ahora tienen 6 años que se han recuperado y para nosotros es genial, pero también tenemos niños que no se han recuperado. Y probablemente no haya ninguna otra intervención que pueda ayudar a que se recuperen. Quizás esta sea una de las pocas oportunidades que estas personas tengan para poder mejorar su nivel de vida en el futuro, ¿no? Entonces, si bien el tema de desnutrición infantil ha sido tan tocado y con poco éxito, no significa que no deba seguir trabajándose en él, ¿no?
A new day begins in San Benito, a township on the northern side of Lima. A new day continues in San Benito, with the people's struggle to overcome poverty and the feeling of being forgotten by the state. The women return once again to their daily duties, and many feel they now have some added support for them in their situation. For many families and for many children, something is changing in their lives, slowly but changing. Even though there is still much to do, many women cannot yet exercise their full right to work, to get ahead, especially those who have been abandoned by their partner. Many children are left alone for much of the day, for many hours, as their parents work long hours and have large distances to travel. Sometimes their mothers are at risk of violence, working in places that are not very safe or healthy. There is much to do to guarantee these rights.
Para eso queremos activar mecanismos de la comunidad de protección, acompañamiento, para que la misma comunidad, las vecinas, los docentes, los grupos que ya existen, los grupos que hemos acompañado en los proyectos anteriores, puedan generar nuevas formas de cómo acompañar a estas mujeres que trabajan y a sus niños que se quedan solos.
In San Benito, the work continues. To build a city is easy. To build the dignity of the people is more difficult. Warmiwasi team is there to support the families in their efforts to build the dignity.